All right. Well, welcome once again, y'all, to our EOPP series, Ask Me Anything, Public Health. We have two amazing presenters in Antonella and Iris. They'll be talking about their experiences in public health, how they got to public health, and how they see themselves in the field. So thank you for joining us. We have a couple things to cover. One is just everyone's currently muted, and let's keep it that way unless the presenters prompt you to unmute yourself. And also the chat will be on, so you can definitely drop things in the chat. But in terms of questions, we're gonna wait till after the presenters speak to answer more specific questions, but feel free to drop some positive praises or some kind of love in the chat. All right, and then the last thing before we start is we'll have all this information available for you. So after the presentation, you'll get an email with all the resources and the information that was covered tonight. All right, so without further ado, we'll get started. And we'll start with a question for Antonella, is to tell us a little bit about yourself, your personal and educational background.
Hey everyone, so my name is Antonella. I did my undergrad in sociology with minors in both sexuality and LGBT studies. I'm originally from San Jose, but before that, I had immigrated from Peru at the age of 5, and I am a cat mommy of 2, Rainbow and Jax. Also, I'm an MPH candidate.
All right, Edie, same question to you.
Hi everyone, I am a third-year UCLA PhD student, so I'm in the Doctoral program of Community Health Sciences. It's in the School of Public Health. I am first-generation college student. My undergrad and my MPH are from UCLA, so I've been at UCLA for quite a while. But I was a transfer student, so I did community college, transfer to UCLA, and I'm really proud of that. And I'm also an immigrant, born to immigrant parents, was born in Mexico and immigrated when I was really, really young.
All right, thank you for sharing, y'all. Okay, so for both of you, feel free to jump in, whoever wants to go first, but public health is such a broad field that can include everything from working in medicine, research, government, education, nonprofits, community-based organizations, and much more. So how did you learn about public health as a major and career option, and what led you to the specific concentration that you were pursuing?
Did you want to go?
Sure, I can start. I actually didn't know what public health was until after I had graduated college. UCLA does not have like a public health major, or they have a minor, I guess, but they don't have a major. And I was also a transfer student, so when I went to UCLA, I had already declared my major and kind of was, hitting the ground running. I was a psych major, so a lot of the prereqs didn't really know what public health was. And so I did a lot of volunteer in psychology. And then right after I graduated from UCLA, I was asked to stay on one of the projects, which was more of a community-based project. So in my psych program, I was interested in stereotyping and stigma and how that affects cognitive and behavior. And when I graduated, I got switched into a completely different project that was working with a community, and it was working with, it was an addictions lab. So I was working with people with nicotine and drug addictions. So it was people in the community, and that's really rare in psychology to work with the community. A lot of psych programs work with undergrads and do a lot of experiments with undergrads and just students in general. But one of the grad students there, actually, after talking to her and telling her that I was interested a lot in research, but I was also really interested in working with the community and doing more like advocacy work, she's the one who's like, hey, there's this field called public health, you should check it out. It sounds like very similar to something that you want to do. And I went to one of the information sessions at school at UCLA, and it was really what I wanted to do. Like you've mentioned, Noe, public health is really broad and you can go in very different directions. And I think the most important thing for me was actually working with the community. And so my first real understanding of public health wasn't until after I left college. I didn't know what that was. So that's how I came across public health.
All right, thank you.
I had a pretty much similar experience. I didn't know what public health was until after I graduated and until I was looking into different master's programs. When I first came into SF State, I came in as a bio major and then soon realized that I was like, nope, that's not what I want to do. So I was, playing around with different majors. I think I switched my majors about 4 different times. And so during my first years of undergrad, I was basically just exploring around different kinds of majors. And my sophomore year of undergrad was when I built up some courage to come out to my friends and family. But I was like yearning to find some sort of community, right? So I ran into this organization on campus called Peach. Peer educators advocating for campus health, and they would be out there just playing games, and they were all surrounding sex education and how to practice safer sex on college campuses to their peers. And I was like super amazed because I had never seen that in my life, right? I came from such a conservative household that sex was always something that was forbidden and never talked about, but me, I was always super curious about everything. So I was like, how do I get into this program, or how do I get into this organization? And when I did, I finally found that community that I was hoping to find during my undergrad. And with Peach, I fell in love with the mission, which was to encourage, support, advocate, but like most importantly, destigmatize, healthy living in the topics of sex education among college students. So even though I wasn't realizing it, I didn't realize it until recently. I was kind of doing the work in public health, but I didn't really realize it until later, right? And I think that's what made me want to go into that field, because it was like Edie said, it's a lot of like community based, right, work. It's a lot of you're in there in the community, and working with folks who represent you, right? So that's what led me into public health.
I also want to add, public health is really broad, and I think every school is different. UCLA has 5 departments. Let me see if I can name it at the top of my head. It's biostatistics, epidemiology, community health sciences, health policy and management, and environmental health. So it's very, very broad. And I chose community health sciences because it was just more in line with what I was interested in. So of course, we all do, we do public health across all those 5 disciplines. Like you need to know epidemiology methods, you need to know biostatistics, especially when we're doing research. But for me, community health sciences was really important because it was a way for me to focus on a particular population that I was really interested in. So just broadly speaking, I'm interested in like racism and its effect on health. But then working with immigrant advocacy groups, that's another niche that I was able to kind of focus on. And I think community health is really important because it really does bring health to the community instead of, I felt like in other fields, specifically, I was in, like in a very experimental psychology field. It was very, very, I felt like I didn't connect with the community, and that's what was missing for me. And that's how I chose community health sciences.
Yeah.
Well, along that same note, I was wondering if you could share with us maybe something or a class that really had a huge impression on you during your undergrad studies related to public health.
Tough question.
Either one of you.
I'll go while you think. It's funny because during my undergrad, like I was saying, didn't really know much about public health, and I didn't even realize until later on that there was a major in health education at SF State. And even though I was, doing the practices of, community work, I didn't decide to go into to health education. I decided to go and major in sociology because I wanted to have like a better understanding of, like Edie's was saying, there's a lot of intersectionality between, racism and the effects that it has among, Black, Indigenous, people of color. So I wanted to kind of have a better understanding of why that was, right? Because during high school or any of my education before college, I wasn't really taught the history of myself, right? Or where I come from, or, why the systems are built the way they are. So I wanted to get more of an understanding of what that was with sociology. And I think I got that. I wish I could have majored in Latino studies also, and ethnic studies, so many more, so many other options too, but I'm really glad that I went that way. So sexuality studies, sociology studies primarily were the primary reasons why I wanted to go through this route, because I wanted to get more information about, how these systems and why these institutions were created in the first place.
I gotta say, I didn't, like I said, I didn't major in public health as an undergrad. So a lot of my, in psychology, it's a very individual focused field. You're really looking at cognition and individual behavior. I think what really inspired me to go to public health is I just went to an information session at UCLA. Information sessions are just kind of like grad school programs. Invite you to come in and hear about their program and see if it's a good fit for you. I went to information sessions in social work and other different types of programs, and kind of just got like my feet wet to see what kind of programs offered. And these are free for anyone who registers. You can go to any college near you. It doesn't, obviously you would want to attend to the school that you prefer to go to. Some of them do it virtual, and I'm guessing a lot of them will do virtual going forward. But UCLA I was really interested in it. So I went to an information session, and I think what really struck with me in terms of that made sense to me is that I understood health being, in psychology, we understand health being like individual health behaviors, but I also knew that, I know how to eat well, but it's not easy. I know that exercising is beneficial for you, but again, that's not easy. And then when I went to these information sessions, they really started talking about these structural barriers that exist, policies, and your neighborhood. Not everyone can, walk out of their house and just walk around their neighborhood or feel safe in their neighborhood to walk and be healthy. Not every neighborhood has a park, and why is that certain neighborhoods, do and others don't? And so when I really started thinking of these macro forces, that's what I was like, okay, this is what I'm really interested in. Like, people know how to be healthy, but why can't we all be healthy? And it's just, it's both, I think it's a combination of both the individual and these like bigger structures. And I think going to this information session was just kind of really drove it for me.
For sure. Sometimes it's those experiences that kind of happen out of nowhere, right? All right. Antonella, your experience in public health includes your background in sociology and sexuality and LGBTQ plus studies, the Willie Brown Fellowship, your work with the peer educators advocating for campus health, aka Peach on campus, and your role as an advisor for SSS-TRIO, advocating for our first-gen low-income students. Can you tell us more about how these experiences shaped your understanding of the role of public health?
Yeah, so like Edith was explaining earlier, right, health can mean so many different things, and it ranges. It's such a huge or broad spectrum of what you can do, right, with it. Like the work within public health can range from, let's say, including like promoting healthy lifestyles or researching disease and injury and prevention, or detecting, preventing, and responding to infectious diseases. But it can also look like, educating college students about safer sex practices. It can look like researching long-term solutions for homelessness in San Francisco, or it could look like EOPP, and creating and establishing these kinds of programs to help first gen and low income students, right, to navigate higher education. But I think that what's most important is that, again, like it's such a broad topic that you can go into, but it's basically just how to improve the living situations, I guess, for different communities. And for the work that I want to do is mainly focus on, like, how can we improve, the living situations of people of color, right? Especially now with Black and Indigenous people of color, and how can we, work on things that are sustainable and long-term solutions for them. And I have these conversations with my students when I'm doing like advising sessions, and I have to have these early conversations with them about, how we don't have the same privileges as maybe our white peers, right? And navigating higher education, but it really shouldn't be that way, right? It really shouldn't have to be us juggling 2 to 3 different jobs, having to also deal with, mental health, or dealing with, responsibilities at home. And then also on top of that, your academics, right? So public health is pretty much like having these conversations about how or what can we do to improve these situations so that we as a community don't have to go through all those hurdles just to get the same opportunities that our, other white peers aren't having to go through. And I think that's what led me more to wanting to learn more about public health and wanting to be in that work. Because we come from that, we come from those communities, right? We are all first gen low income students of color, right? So yeah, I think it's important that we represent ourselves and are constantly working on ways to improve our community.
Yo, I feel that, Antonella. Folks, pay attention to what you're involved in, and I think we start to notice, like, hey, that needs attention. And I think a lot of us go through that, right? Like recognizing, like, yo, there needs to be more done in this area. And so, thank you for sharing that. Iris, one of several similarities you share with Antonella is that you have also experience working in higher education, serving as an academic mentor at UCLA. Since then, you have helped manage several research projects, most recently the Rights Project, the research on immigrant health and state policy, a study at UCLA that is looking into experiences of Californians who were born in Asia or Latin America as they seek healthcare, go to work and school, and engage in their communities. Can you tell us more about the inception of the Rights Project and your role as a project coordinator, as well as the personal significance of pursuing projects that advocate for the needs and concerns of underserved populations?
Yeah, definitely. So I was really lucky. That I started my doctoral program when the Rights Project started. So the Rights Project is my advisor, Stephen Wallace, is kind of the principal investigator. And part of being a PhD student is that you are, you're there for the research. So you want to get some research experience, obviously, but you also need funding, being in school for this long is really expensive, and a good indication of any PhD program is that you're funded. So what the Rights Project does for me, it actually funds my doctoral studies, which means that I don't have to, I'm funded in that the project pays for my tuition, but I also get a stipend. So I get paid to basically do the day-to-day activities of the project. And it's a study it's a qualitative quantitative study, so mixed method is what we call it. It's in collaboration with the California Health Interview Survey. So if anyone's familiar with CHIS, it's a statewide survey. I don't know if anyone has participated in it, but whenever you get like cold calls of like interviewers asking you if you want to participate in this study, it gives a snapshot of California's health, and it goes on every 2 years. And so what we do is we actually do a follow-up study. So anyone who's participated in the CHIS survey, who is from Asia or who was born in Asia or Latin America, are eligible to participate in our study. And we do some follow-up questions about their experiences with state level policies. And we look at state level policies across different sectors. So not just health, but for example, we ask if people have driver's license, because there's state policies that California doesn't have it anymore, but it used to where you couldn't get a driver's license if you were undocumented. So what does having access to a driver's license have to do with health? And those are things that we're interested across different sectors. And then we're also doing what is called a qualitative interviews, where we do in-person interviews with Mexican and Chinese immigrants in Los Angeles and Orange County. So I've been a part of doing those in-person interviews. And over the summer, we've been just kind of doing the data analysis of that. We're wrapping up the big survey, but what we're doing now is doing we're doing the data analysis and writing up the papers for the in-person. And yeah, it's a multi-year, so 5-year project, which is how long doctoral programs are. So hopefully this will be my funding to the end. We're in our 3rd year, and it's also collaborative with different professors across the departments. So it's a good way for me to get some research experience, get some funding, and then collaborate with people. So I think and then on top of that, I think the other question is, why is it important to have people who are from those communities kind of doing the research? I think it's really important. So we actually have a team that's big enough that does, we're both like Asian immigrants and Latino immigrants, and our experiences can be very similar, but also very different. And those differences, those nuances are really important in understanding what we can do to prevent or give people access to healthcare, better access to healthcare. And I really do believe in centering in the margins, which really means, looking at the most vulnerable population and helping them out, because I really do believe that when you help the most vulnerable, then it kind of makes the playing field equal for everyone else. You don't want to focus on those who already have all the benefits. You do really want to focus on the most vulnerable. So I think that's really important.
Yes, thank you for sharing that. All right, y'all. So this question's for both of you. Racism has always been a public health issue, but now we have to face a COVID-19 pandemic as well. What are some ways we can better advocate for Black and Brown communities from a public health perspective?
I mean, a weighted question, right? I think one of the biggest ones that we've seen on the ground, especially right now with the rights study, is I think we don't really realize that a lot of these, what we call like race neutral or immigrant neutral policies, and I'm going to put those on quotes, really do affect, Black and Brown individuals. So for example, you guys probably are familiar with the federal stipend that the government gave. It was for individuals and families. Well, if you're undocumented, you actually don't receive part of the paycheck. And same thing with the Affordable Care Act. Undocumented immigrants are not part of the Affordable Care Act. And we also know that there's this public charge policy that's coming around that the Trump administration is talking about, where even those, again, undocumented don't have access to healthcare, but not only that, people who are on their kind of pathway to residency or citizenship might be ineligible to become U.S. citizens if they are, quote unquote, deemed a public charge, which means that they're using government benefits for, for living, basically. But we also know that a lot of undocumented immigrants and immigrants in general pay taxes. but they're not getting the benefits of their fruits of their labor. So I think one way to advocate is really kind of pushing for more inclusive policies, more just policies. Maybe that's just what I'm thinking at the moment. I'm sure there's many other ways to get involved on the ground, but I think pushing for just better policies and honestly just a better administration.
For sure.
Yeah, I definitely agree. I also agree that this question is very weighted, because there's so many simple solutions that that can for health disparities that Black and brown folks face on day-to-day basis, right? And like some long-term goal would be just having more low-income communities adding like more funding, right, to public schools so that they have a better opportunities for higher education, or even just simply providing free healthcare for everybody so that during this time we can all get tested, right, and not have to deal with the huge expensive bills. But I think one of the things that we can start doing right now at us, right, is just creating more spaces for Black and brown folks to be heard, right, and start holding folks and especially institutions accountable for sustaining so many barriers for such a long time, right? And then also, I think at an individual level, we can also start by decolonizing ourselves, right? Because I think that we won't have liberation until all of us have, have had some sort of decolonizing, because for a long times we've been embedded with these mindsets that we were taught from a very young age to value, European ideologies, and maybe we can start also by having more conversations with family members about colorism, internalized racism, homophobia, transphobia, and start challenging ourselves by recognizing the privileges that we already have, right? And based on our skin color, and then because right now during this pandemic, and for a long time, and the reasons why Black Lives Matter is because our Black and brown siblings are dying at higher rates because of the color of their skin. And a lot of it has to do with police brutality and COVID, right? So we have to start having these conversations and start pointing them out, but also work on ourselves to unlearn all those things that we've, all that mindset that we've been embedded with, that have sustained anti-Black institutions, right, and anti-Black structures already. So I think the public health, or what public health does, is having these conversations and dismantling institutions that have sustained these circumstances for Black and brown folks for such a long time. So I encourage students who are already at SF State, right, to get in, start attending, some AS meetings, associated students, right, or with the Black Unity Center, or with the Black Student Union, or the Dream Resource Center, and learn more ways about how to be more involved in your communities. Because I feel that the more you are involved within your own community, right, the more you are going to be putting in that work, because nobody can tell us our lived experience but ourselves, right? So the more we are involved with that, the more impact it does for our communities. So yeah.
Yeah, you answered the question I was going to ask next, which was what would you advise students that want to get involved, or what would be the first thing, like, okay, I'm going to be involved starting tomorrow, but how do I start?
Oh, me again?
Well, I mean, no, you answered some of it, right, with where to go, which organizations. But if Edie's has something else in terms of like how to get involved.
So one thing that I did that I thought was really, I don't know if it's, helpful, I guess I would say, is I actually, so to get him, I got involved in research pretty early at UCLA, again, because I was a transfer student, and I knew that was really important. And research is also gives you a lot of skills that you can use even outside of just research in the classroom, which, you know, critical thinking skills and things that you can put in resumes if that's not kind of the path you want to go to. And it's also an opportunity for you to know whether or not you actually do like research and this is a path you want to go to. And if it's not, that's okay. But I think one thing that I did is I actually looked up professors and kind of looked at their background and the research that they were conducting. And I think the most important thing for me that I found really helpful and useful is that I always try to look for someone whose interest matched mine, because I found that for I was just going to be the happiest or put the most effort into projects that were really meaningful to me, rather than trying to you know, fill my resume up with smaller different types of projects. It's better to show that you can like kind of show dedication, that you've participated in a project for a long time, and even how your roles may have changed in that project. And so it's not that I had a ton of different types of research experiences in my undergrad. It was that I really did look for projects that were really meaningful to me. And that was a way for me to kind of, I think, my own enthusiasm. I think I also coordinated research projects after I graduated, but you really you can really see when someone's like really interested in the type of work that they're doing. And I kind of felt like I didn't have to fake it because I just was really interested in the types of projects that I was already involved in. So I think an advice would just be like, go after things that you're passionate about. Like, don't, you know, and if you don't know, it's always good just to try it out. And if it doesn't work, then it's no harm, no foul.
For sure. Yeah, y'all, it never hurts to, like, you know, as cliche as it might seem, is go visit the website, right? Sometimes they're like,
follow the hashtag.
Yeah, that's what it takes sometimes, y'all. Follow the Instas, but go to the website and see what the school and the programs offer themselves, and you know, does that feel right? Does it activate your gut telling you, yes, this is the way to go? Okay, all right, continuing on. Can you share with us, y'all, you know, maybe your biggest challenge and maybe a piece of advice for your pre-public health self, translating into the students that are on the call today, right? So let me rephrase that. Your biggest challenge that you overcame in this field, and also maybe your one piece of advice or several pieces of advice for students interested in public health.
I would say one thing that I like regret most during my undergrad was pretty much not speaking up for my needs as much as I should have, or even just seeking more help when I knew things were, you know, spiraling down for me. And I think a lot of it had to do with, you know, that mindset again that I grew up with, and thinking that I had to keep everything to myself, right? And always assuming that nobody else was going through the same things that I was going through, right? And I kind of grew up, you know, romanticizing my struggle, and because of it, because I was so used to it and so comfortable with it, right? And these obstacles and hurdles were just like everything I ever knew, right? So I was just comfortable not seeking help. But then I came and realized that there were so many incredible people out there and so many communities out there and programs like EOP, right, that were there the entire time, right? We're there waiting for me to come in and waiting for me to talk to them, to seek help from them. And honestly, that's what I do now as an MPH candidate. Like, I always turn to my peers, always turn to my cohort, always turn to my coworkers, you know, just getting some kind of community with the people that are already around me, right? Because we're not all going through the same struggles, but like we're all in this together, right? And like I said before, I feel like we are the only ones who, you know, understand how tough it can get out there, right? But I think by having each other's backs is like the most powerful thing that we can have for ourselves and our communities. So I would say and recommend and advocate for you to reach out to your, you know, to your advisors, reach out to your mentors, reach out for that help that you might need or might not know that you need, right? And just talk to people, because you never know that they might be the light that you were looking for, or the inspiration that you were seeking this whole time.
That's really good advice. Even for myself, I'm like, yeah, I need to do a better job of advocating for myself for sure. No, that's really good advice. And it's hard to do, but I think it's, you know, it's important. I think, so I'll start with my biggest challenge. I think as a student, I'm kind of in the idea of like professionally in public health. So public health is, how do I say this? It's a little better when it comes to topics that are sensitive, like racism is, and talking about race and its effect on health. I think more so than maybe the discipline that I was in before. But even I think it was still really hard to talk about experiences that happened personally that you know have happened to you, and you're like, and I'm talking specifically about racism, and just kind of even naming it in classes with peers who might not understand you because they didn't come from the same background as you. I think that was a challenge as an undergrad, and I think it's gotten better now that I'm in, you know, I'm in grad school, and I started the program saying like I'm interested in studying racism and not like race, ethnicity, and health disparities. I think it's really important to name things. So I think professionally that was kind of a big change for me, is kind of just naming what it is that I'm interested in, but also having professors who use that term kind of give you like the permission to use that in the classroom as well. I know not permission's not the right word, but I feel like that's a sensitive topic for some people, and people are not comfortable with it, so you'll get a lot of pushback like, but racism doesn't exist, you know, stuff like that, which, you know, we all know that's not true. So I think professionally was just kind of just naming it and not, you know, not kind of backing down from what you said, and just being like, this is my experience and I'm not going to change who I am because of that. And then I think the biggest advice, in addition to advocating for yourself, is I think finding a good mentor. I think one of the reasons I am where I am is because I've actually have been really lucky and had mentors throughout my my trajectory in school. And those mentors are going to change depending on where you are in the program. So my mentors in undergrad are different from my mentors in grad school. I still keep in touch with all of them because I develop really good relationships, but I think it's really important just to have a really good mentor, someone who can help advocate for you, because, you know, differential powers, you know, that's important. And so if you have someone who's, you know, has some power over some of the decisions that happen behind closed doors that students are not involved in, it's good to have someone who can fight for you.
Yeah.
All right. There you have it, folks. I was told that I can ask a question of my interest.
I know. You said you weren't.
I think, I mean, just because I think it's at an intersection of our lives, right? If you can recommend one documentary or film related to public health that you think folks should watch, can you say that film and why?
That's hard because everything is public health.
Well, I mean, just anything, yo. I mean, just.
I have to think about that one.
We got time.
Oh my gosh. Do you even have time to watch TV? Actually, I think one thing for me is just for kind of self-care. I feel like my work is already a very hard thing to be in, when you talk to people in their lives and how, their struggles, and it's not always fun to read and about racism and how it's in everywhere, and even the air that we breathe in. So I actually try to not watch documentaries or things that are like super hardcore like that. I'd rather like just watch nice other feel-good movies. So I
Hey,
have
all
to think
right,
about
let's
that
go
too.
with that. What's the feel-good movie that you recommend then? Let's go there.
I like that better. I was actually gonna start. I forgot to mention about self-care that Edie was talking about earlier. Self-care is so important, y'all, and I am such a hypocrite of it too sometimes, because like I tell myself I need self-care and then I don't do it. But it's so important. You need to find something that talks to you, right, and would help you kind of de-stress a little bit. I think lately what I've been doing is just reading a lot of, or not even a lot, a couple of poetry books. That's kind of has me grounded back again. And I started recently listening to a podcast about finding your higher self. And why I did that is because, as first gen students that come from, low income backgrounds, I don't think there's ever a phase in our lives where we don't face imposter syndrome, because we're just stepping in these institutions that were literally not made for us at all, but somehow our resiliency, our courage and ability to just navigate through it is what keeps us going, right? And it's so powerful to come back to yourself and tell yourself like, dang, like I did that, right? I was able to do that. And for me, being a person who went through that, navigated that on her own, and now being able to give that back to my students and have those talks with my students about like, it's not just as simple as like, I did it, so can you, but like how giving out resources for the students so that they have, they don't have to face so many barriers, right? Or are more aware of like what's coming to them. So I think that's very, it's very powerful. Self-care is everything.
All right, we'll take that. We'll take that. All right, well, thank you for sharing, y'all. We will have a chance to ask questions to our presenters. So I want to thank you first of all for doing that. We're gonna transition into kind of like the advising portion of public health, and I'll hand that off to Julia and Kim to do that for us. But hang tight. The question will be towards the end, but we're gonna transition into this advising piece.
Hi everyone, I'm Julia. My pronouns are she and her. I am one of the EOP advisors. I'll let Kim introduce herself.
Hi, I'm Kim. My pronouns are she, her, hers, and I'm another one of the EOP academic advisors.
So we're gonna pull up this little presentation that we put together for y'all. It is a little bit on the advising portion. We unfortunately were not able to get someone from the public health department to come in. So we're just gonna have to make do with the few of us here. So please don't ask us too difficult of questions. Okay, here we go. Can everyone see my screen? Yes, okay.
Yes, I can see it. Hi, Julia.
Thank you, Alice. Hi. So we just wanted to put a little disclaimer out here. So please make an appointment to see your college or major advisor. We are not health professions advisors, just mere mortals. This is very, very important. So if you are new to EOP specifically, your EOP advisor is more for lower division staff, GEs, kind of like that more general education part of your experience here. But when it comes to your major, especially once you get to the upper division, you definitely want to make sure that you're making an appointment to see them. If you're curious about certain majors, again, go see the experts. While we have done a few AMAs already and they've been mostly in like the health professions field, besides Antonella, like our backgrounds are not in any of the health professions, so please go see those advisors. We will provide the information on how you can make an appointment to see them as well. So first things first, I'm going to, let's see, drop in the chat the resource guide that we put together for y'all. It is a combination of everything. Let me see. So it's going to be in the PDF format. You should be able to click on all the links. So when you open it, you will see information about the College of Health and Social Sciences, which public health is under. Also information about the public health department. It is formerly known as health education. So that's why you'll see a lot of terms that say like health ed or HED, but now they have switched over to public health. So the first thing we want to do is make sure that you know that the College of Health and Social Sciences has a website. We want you to know that there is a resource center there as well where you can meet with advisors. And also like it includes information about the various departments. If you have questions about workshops coming up, so for public health, there is a mandatory workshop component, so you would find all that information there. So please make sure that you know where this resource is. And again, if you click on advising, you can click on the link to schedule an appointment to see an advisor there. For the Department of Public Health. So if you go to the CHSS website, there's also like, if you click on departments, you'll see Department of Public Health. Again, if you are actually interested in majoring in public health, doing the minor, we also have a minor in women's health issues. Like that's really cool. If you're interested in the MPH program we have at SF State, all the information is in this part of the website. Okay, so applying into the major. Again, not the experts, but this is generally the information. So one of the biggest things that all the public health advisors tell us is that you need to do the workshop in order to actually get into the program. It's where they give you that supplementary application. So because public health is actually an impacted major here at SF State, you need to go through an additional application process. So if you are currently here as a freshman or a sophomore student, you do need that application. If you're coming in as a transfer already in public health, you do not need to fill out that application. So in the meantime, like I'm
gonna be fucking stressing out at home instead for no fucking reason.
Okay. Anyway, so when you are applying to the public health major, usually students will look for prereqs. So you do not need to take the lower division requirements as prereqs. That means that if you didn't take them already, it's not going to prevent you from getting into the major. So the next slide is going to be on these prereqs, or not these lower division requirements, sorry. So for the health education BS, it is 62 to 65 units depending. There are a bunch of lower division classes that you can take without having done any prereqs for them. So you can get into Bio 100, Bio 210 in your first semester here at SF State, again, Math 124 or ISED 160. These are all classes that you can take beginning the first semester that you're here at SF State. For the minor, there are only 2 required courses. The rest are electives actually. So these 2 as well, they do not require any prereqs. So if you are serious about pursuing public health, I would recommend that you take one of these classes and get a feel for it and see if it's a good fit. Again, it's very important to know what you like, but also what you don't like, right? Okay, this is all Kim now.
Okay, so kind of to go into the graduate programs, right? So of course you do want to kind of do research depending on where you're thinking of attending for your graduate program. We kind of, for our presenters, went over SF State and UCLA's prerequisites for their programs. So you can see even the differences just between these 2 programs, right? For SF State, you do need to attend, much like the undergrad, an MPH info session they do have prerequisite coursework that could be covered in your public health undergrad, but they do also provide on their website a list of classes, like descriptors of what would count for those classes. They do also require a minimum of 3,700 total hours of work experience. So you do have to kind of keep that in mind when you're pursuing a graduate program, is that they do look at your work experience. You will need to submit like a resume or a CV of some type. They are looking at your GPAs and letters of recommendation from your professors or professional references. And then there's also the GRE. So we're going to go over that a little bit later, but there are sections where they're expecting certain scores, but there are also kind of benefits. So there's a portion on their site where they said that those who have linguistic competence in English and a second language have a strengthened application. So sometimes having a diverse background can definitely help you in getting into different graduate programs. In comparison, UCLA, it'll depend on which concentration or dual degree program you plan to pursue. So for the MPH in Community Health Services, there were no specific prerequisite courses, but they did state that work experience is strongly preferred. They are still looking at your GPA. They are still taking into consideration your GRE scores, and they still need those letters of recommendation. And they specified who they wanted those letters to be from. So even just these two programs, you can see there's differences in those prerequisites in what they require in the application. So it does take some additional research to see what your particular institution will require of you. Cool. And so just to go a little bit into the GRE exam, so it's 3 hours and 45 minutes. It's 280 questions. So it's a hefty exam. It's divided into 3 sections. So there's the analytical writing section, the verbal reasoning, and the quantitative reasoning. So each section is being scored separately, and they do have like a certain amount of questions for each of those sections. Additionally, an unidentified unscored section may be included and may appear in any order after the analytical writing section. So they kind of throw in this 4th section that may or may not be graded. It is quite an intense exam. I have not personally taken it. Maybe one of our speakers or anyone else who's gone through a graduate program can speak on it and their experience with it. But it is going to be a requirement for most graduate programs that you're looking into.
I took the GRE quite a few years back, many years ago. But I do remember that surprise section. I remember praying very hard that it wouldn't be math, just because I'm terrible at math. But definitely, like, we put some resources in the resource guide for that GRE prep. But my biggest advice for anyone attempting to do the GRE is to build up that vocab. Like, the English section was really hard. Okay, like that vocab comes out of nowhere. So definitely focus on that. And depending on the program that you're applying to, this doesn't matter whether it's public health or any other program. A lot of times they're focusing on just 1 or 2 elements of the GRE exam. So I know that for a lot of my friends doing education, they didn't look so much at the math. Some of my friends who were doing like psych, however, like that math component was a huge factor. So just be mindful of like the type of program that you're going into and also the concentration.
I do also want to mention, because I took the GRE to get into MPH, the MPH program here. And I am such a horrible test taker. I just, freeze the entire time, and I just don't know what I'm doing or what I'm reading. So one of the good things about this specific MPH program at SF State is that the GRE doesn't have to entirely reflect on whether you would get accepted into the program or not. One of the things that there is like a supplemental thing on there on the application that you could turn in a writing sample instead, because all they're looking for is the analytical writing section, right? So if you don't get a score, a 4 score, right, like they're asking, you could also then churn in a writing sample so that they can know, what your writing is. For folks who are, scared about taking the GRE and worried about not getting the right score, right, whatever that means. And yeah, there's that alternative.
Also, not every single program requires the GRE, so definitely do your research.
Yep. The only nugget of info I have for that is like kind of like the SAT. You want to know the rules of the exam in terms of like what does it mean or what happens when you get one answer wrong, right? Or versus omitting an answer. Yeah, just when you're ready for it, just start looking at some practice questions. Maybe there's some apps for it, but the resource guide has some starting points, I'm assuming. Yeah, okay. All right.
So this last slide that we're going to pop up here is just how to make an appointment with the various departments on campus. So for instance, if you want to meet with someone from the Student Resource Center at HSS, if you want to meet with the MPH advisor, if you want to make an appointment with your EOP advisor, hint, hint, all this information is really good to have in your back pocket. Again, you can screenshot this, but also it is available in that resource guide. I'm gonna turn this back to Noe now.
All right, welcome back, folks, to the AMA portion of this presentation, where we will now turn the tables and give you the microphone. What do y'all want to ask our presenters about public health, or are there any comments that you'd like to make? Now's the chance. So what you can do is write something in the chat, or go ahead and unmute yourself and ask away, y'all.
I have a question about the degree for I made something on the comment about like the difference between the MPH degree at UCLA versus the BA in public health at UCLA, and also like what kind of job will MPH will get you into, because my goal is to move to LA and become a film director. That's why UCLA is my big school, like my dream school.
That sounds like a cool job. So as of now, there's actually no bachelor's degree in public health at UCLA. Like, I don't think that exists. I know they are in the works of trying to create it into a major, but as of today, it doesn't exist. There's only a minor. And the MPH, as you already know, it's a master's program, so you have to have a bachelor's before you can even apply to the master's program. In terms of getting jobs, so I kind of stayed on. So in order to get a doctorate in public health or a PhD in public health, I had to have a master's, or students have to have a master's. So what I did is I actually continued on and stayed on at UCLA. I was able to do that. So I applied to the PhD program straight from the master's program. So I actually never had a job with a master's. So I don't really know. I guess my peers are kind of all over the place, and because I did mines in community health sciences, a lot of them are working in like program implementation. So like interventions and program implementation in terms of different fields like HIV and God, that's the only thing that's coming up to my mind. But yeah, so I've never really had a job because I've transitioned straight into the PhD program.
So as a PhD, like, do you have more things like for a PhD program? Do you have more like resources to get a job, like more opportunities, like the job opportunities once you get your PhD?
So it's not about job opportunities, but it's more about what you want to do with a degree. So I was particularly interested in research, and so a PhD, that's what they do. They train you in becoming a researcher, an independent researcher. So that's why I decided to get my PhD in public health, because I'm really interested in conducting research. So it's not that it gives me more jobs. I would actually say the reverse. It kind of limits my job opportunities in a sense, because it's a very, very, it's a very specific training that I'm getting it through my doctoral program, which is basically how to conduct research. So it's very specific. I don't think it's opening job opportunities, unfortunately.
So can you be a doctor or a lawyer for Masters of Health, like for a PhD in public health? Like what kind of job does a public health in general do? Because like, I know there's a job for lawyers, there's usually like a specific job, but like not so much for public health, you know.
If I'm understanding your question correctly, like what can I do with a PhD? Is that?
Yeah.
Essentially, conduct research and essentially kind of like just be a professor. So if you probably look at a lot of your professors, even at the Cal State, probably have PhDs. Even at the community college level, most of them have PhDs. Definitely at a research institution, you have to have a PhD. So the type of work I would do is either be kind of like a director for the center of what I work in, which is conducting research, or teaching. Really is kind of, those two are the main areas that I know of, besides consulting, that I know of that doctoral students have gone into.
All right, we do have a question in the chat. It says, what internship or volunteer opportunities would you recommend given the circumstances we are in?
That's very, yeah, it's very unique. I mean, I think we're all still kind of getting the hang of, you know, trying to figure out how we're going to go about, you know, even just going back to school or, you know, going back to work. So this is going to be a little bit, I think, hard, but I think what you can start doing is maybe just start talking to your college resource center and see if there are any, you know, internships, opportunities, or just like info sessions that you can attend, right, to get more information of, you know, how you can be more involved. During my undergrad, I did the Willie Brown Fellowship, and I was able to get an internship with the Department of Public Health in San Francisco. I don't know what exactly they're going to be doing for this new upcoming year, but I would go in, you know, I think it's in the resource file that we have for this AMA, right? Definitely check them out and see if, you know, see if they're doing something this fall semester to get involved.
I think we're all dealing with this uncertainty of what things are going to look like for everyone, all of us who are, you know, experiencing our students during this pandemic. I don't know if the question specifically, like, because I know some public schools, I know UCLA requires the master's students to do an internship, and so that's a specific type of internship. And then there's like volunteer internships, kind of just more to get your experience with different maybe subjects or things that you're interested in. So those are kind of two. One of them is mandatory and the other one's more of like, hey, I want to either get paid or get some experience so I can put it down in my resume. So I can talk a little bit more about kind of the getting paid or putting down in the resume. Honestly, I think we're just gonna have to get uncomfortable and just kind of cold email professors and ask if they have anything available. I know for the Rights Project, we had a couple of, like one undergrad who emailed us, and although we're not looking for anyone, I know that in the future, if we ever need an undergrad in a project, she's gonna be the first person we go to, and might be not even posted online with other people to let them know. So I think kind of just cold emailing people or organizations that you're interested in volunteering and see if they have any work for you.
Yeah, Brittany, who's also not only an EOP, is an EOP, but it's also an MPH candidate like me. She's my peer. She just mentioned to me that HPW, Health Promotion and Wellness Department on campus, will be hiring for fall 2020 ambassadors, peer health educators, kind of similar to what Peach, when I was involved in Peach, are doing now on campus. And I think she mentioned that the deadline to apply was August 19th, and you can find more information on their Instagram page. And you can get direct contact visiting their website as well. That's HPW. Yeah, there you go.
There was a question in the chat about whether internships are open to folks with 8540 or documented. folks, that the only thing that might prevent you from getting an internship would be if something is federally funded, because sometimes, for example, I know some of the NIH research opportunities are federally funded, so sometimes they can't hire students that are not citizens. But there are places to go, like SF Dream or something like. I posted the link on the chat. But there's also something called Immigrants Rising. That's Bay Area help with undocumented folks. They have a list of undergraduate scholarships. So it just depends on what you're looking for, but there's definitely opportunities out there, and it's always good to ask as well. If you ever see an opportunity that says proof of citizenship required, there's nothing wrong with asking why, right? Like, oh, why is that required? I know there's some scholarships that in the past they would say proof of citizenship required, but thanks to like the Dream Resource Center, they've been able to remove those caveats of citizenship. So whenever you see an opportunity, if it explicitly says that you can't participate unless you're a citizen, you could always ask though. So don't let that stop you in general. Cool. Any other questions out there for our presenters, y'all, or in general? You can ask in the chat or unmute yourself. Oh, the degree. So there's a question in the chat. It says, I wanted to ask about the dual degree programs with MPH and how does that process work?
I can talk about the UCLA one because that's what I'm familiar with, if that's, so at UCLA, there's different types of dual programs. There is a dual master's program. So like you're getting your MPH with another master's program, whether it's in social work or Latin American studies or any other type of master's program. And then there's also dual degrees for people who are MDs, so medical doctors. And the way that works is that you actually, for UCLA, you have to apply to both programs separately and get accepted to both programs. And by, I mean separately, I think you still have to say that you're applying as a dual, but you have to get accepted by both program A and program B. So like you have to, for example, if you want to get a dual degree in public health and social work, then you would have to apply to the MSW, the Master's in Social Work, and you would have to apply to the Master's in Public Health, get accepted to both. And then I think what it does is you complete your degree in 3 years versus 4, whatever you would take you, because of each program is 2 years, then it cuts by a year. And then, but you still have to, fulfill both of the requirements. I don't think there's like, or I don't know, actually the number of classes, but I think is I think it really just depends on which 2 master's programs that you're applying to. So then at the end of the day, when you graduate, you are graduating with 2 master's degrees in that case. For the MDs, it's the same thing. If you are, you have to get accepted to medical school, and then you have to apply for the MPH. The medical one, I'm not too familiar with. I think you apply to the medical program, like to become like a medical doctor, to the MD program, and in their application there might be like an indication that you're interested in also in public health. So actually, when I was a master's student, I had MDs in my cohort who were doing their masters in public health and community health sciences, and they actually have a year, so they kind of take a break between being going to school for medical doctors, and then they finish their entire masters in 1 year. So it's a little bit more fast paced. And those are, for folks who are interested in being a medical doctor, but also understanding these, like I said, macro factors that also affect health, macro factors that affect health.
All right. While y'all are brewing up your other questions, I have another question for y'all. What do you see yourself doing once you're done with your degrees? That's an interesting question.
You're asking the audience?
Well, the presenters, yeah.
I'm still trying to figure it out. Even though I'm already in the MPH program, I had to had a background in, you know, sex education, and for the longest time, sex education was like my main focus, but then I became an academic advisor and fell in love with higher education. So MPH is kind of helping me, you know, take these two passions that I have together and somehow, you know, mingling it together and see where it goes from there. I'm still exploring. You know?
Yeah, I'm on the same boat. So my, you know, the doctoral program is a little longer. It's usually 5 years. I'm in my 3rd year, so I still have like, you know, a good 2 years to go. You know, I wouldn't have done this unless I'm interested in research, because that's all I do all day, every day is research, and that's why I'm getting the PhD in it. So hopefully something with research, maybe a professor. Yeah.
All right. How about this one? Oh, wait, I lost my place. Oh no. I highlighted one here. Just in terms of like, how have you seen public health develop these last few months with everything going on? Like, what's your take on like what's been going on, and just in general, what does public health look like in the near future?
I think since COVID has started, you know, public health has definitely been kind of center stage in this pandemic, because this is what we basically do, right? We epidemiologists track disease, and, you know, there hasn't been a pandemic since, you know, 1918. But so I think one thing that's really cool about being in this field right now, today, in this moment in history, is that I think before, people didn't really understand what public health was, and, you know, people are learning and hearing about it now. So I think that's really cool. You know, my family knows I do public health, but they don't really know what that is. But now that it's center stage, they're like, oh, that's, you know, it's pretty cool. And then I think it also kind of sheds light into how broken our healthcare system is here in the US. And, you know, that there still needs a lot of work to get done. How is it that one of the richest country in the world can't provide basic healthcare to, you know, the people who live here? So I think it's done 2 things: put it on center stage so people know what public health is about, and the other thing is just, you know, really showing us that there's a really long way to go.
For sure.
Yeah, I agree with everything you said. You touched on it perfectly.
All right. Building off that question, how do you explain this to your family, to your parents, to your relatives? Like, when you're explaining what you do for education or a living, how do you go about that?
When it comes to explaining to my parents what I do right now as an academic advisor, I usually, because in high school, I was part of a program called Upward Bound, which is a pre-college program, right, at San Jose State. And the main coordinator for that program, her name was Blanca, and she was pretty much in charge of like the entire program. Like, that woman, wherever she may be, bless her, because without her, I would not have, you know, been able to come to college. So, and a lot of things that my parents would see her do is pretty much, you know, help me understand what I needed to do in order to get to college, right? That's pretty much like the simplest way that they could understand it. So whenever I'm, you know, they ask me what I'm doing, I'm like, oh, I'm another Blanca. You know, I'm doing the work that Blanca did, so to my other students, and they're like, oh, okay.
Dope. And what about like your trajectory though? What are you heading to? What do they think you're doing next?
Well, I'm telling them that in my master's program, I am in public health, right? So now, like Edie said, we're at the, you know, center of everything during this pandemic, and people are, I think most people already know how broken the systems, you know, have been for a long time, but now to also have it be amplified at a national level right now. Everybody, like, you cannot get away from it. And I think that's, you know, in some ways it is a good thing, because now we can start holding people accountable, you know, and like building new systems and building new ways and resources to provide and create new systems, right, for our communities. So yeah.
Sure. All right. I want to check in if anyone has any questions to chime in right now in the chat, or you can unmute yourself. If not, we have a couple more to go off of here. All right.
I have a question.
Yeah, go ahead.
So basically, for let's say if you want to become a doctor, right? You still have to like, what was the goal to become a doctor, like a medical doctor? Do you have to get an MPH degree to get a doctor, or like is there some, because you were talking about GREs, right? Like, how is becoming medical doctor different from becoming an MPH or JD? Like,
I can answer this. So MPH is a Master in Public Health, right? So it's just a completely different degree. To be a medical doctor, you have to apply to medical school, which is completely different. So to be a medical doctor, you can actually major in pretty much anything, and then you have to apply to medical school. So there's just completely different career trajectories. So like someone who gets an MPH cannot practice medicine or be a doctor. It's completely a different industry, completely field. Like you wouldn't actually be practicing like a doctor or anything. It's just it's different.
So basically, someone mentioned about like public health. Like, can you get a doctor like in public health, like like an MD for public health? Let's say like, if you want to become a doctor, like how is public health has to do with like a medical doctor per se, like when it comes to career?
Well, our presenter today is part of a doctorate program in public health. But what's the, in terms of, can you repeat the question about like?
Like let's say if you want to become a doctor, right? How is public health has to do with like becoming a doctor?
Oh.
So I can try to answer that question, and this is kind of what I use to explain to my family why I'm in public health, and so they know that I'm getting a doctorate degree. So the doctorate degree is really like, if you know, like if you look at anyone's title, it says PhD. So it's a philosophical degree. So it's a really, like, you're really learning about research. It's not, you know, practicing medicine, and it's not clinical work. I think the biggest difference when I talk to undergrads who are like pre-med, and then I like talk to them a little bit more, and they're like, you know, it actually sounds like you want to do public health more. The way I explain that difference, and the way I explain it to my parents, is, you know, when you think of a doctor, they're seeing patients, individual people, and they're kind of providing a diagnosis and treating that, whatever that diagnosis is. So let's think of like hypertension. You go to see the doctor and you have high blood pressure, they give you medication for that high blood pressure. For public health, I think one of the things that we're really interested in is prevention. So trying to prevent people from getting sick before they get sick. And so you can think of programs that prevent this. So for example, is there a way that we can create healthier foods that people have access to, so that they don't consume like maybe a lot of salt that can increase a lot of, you know, problems that come with like diet, for example. So it's more of prevention, trying to prevent, you know, trying to keep people healthy before they get sick. Whereas a medical doctor, you're really already seeing them when you're kind of like sick, and it's on an individual basis. And public health is more broad. So I'm looking at a population. So my patient is not an individual, but my patient is really a population. So whether that's Los Angeles, whether that's immigrants in the United States, the population is, you know, big numbers, aggregate, a lot bigger, if that makes sense.
Thank you. Because I want to plan to become a doctor, like it's either lawyer or a medical doctor. So like dealing with my goal is to become a doctor or a lawyer that deals with like patients, you know. I'm more into the lab. So public health doesn't do labs, right?
Hi, I have a question. So I was just wondering, like, since, being an undergrad, I received like financial aid, to pursue like my higher ed. And I was just wondering, like, how is there like financial aid for graduate programs? Like, how does that look like? Is it scholarships or like fellowships? Like, what is that? Can you tell me more about it?
So I can tell you a bit about my experience. So I applied to UCLA it was a good fit for me for 3 reasons. One, there's people in the program who are doing the type of research that I'm interested in. So people who are looking at structural racism and how that affects health. Another one is like, it's really close to home. So I am from Los Angeles, my family's nearby. But then the third one was really, there's funding available at UCLA, and that was really important to me. So I think after undergrad, like, you don't really receive financial aid, because I was also receiving financial aid in undergrad. And then in grad school, it's usually just loans. But when I went to the information session, they said that UCLA said that they had funding opportunities available for master's students, and that's really rare. And so one of the reasons I applied to UCLA was because there was funding available. So I funded my master's degree through a scholarship I received from UCLA. And I didn't apply for any scholarship. They just kind of chose me through the application. I think it's part of like the personal statement I submitted. So it was a combination of both financial need and, I don't know, maybe something about my personal statement and grades. And then the other way I funded it was I was a college academic mentor. And so they paid for tuition. At UCLA, they do charge, it's more expensive to be in a master's program because it's a professional degree, so there's professional fees. That wasn't covered. It's around $7,000 that I had to pay out of pocket, but that's compared to like maybe $27,000 a year was not, it was still a huge help. And then PhD programs are usually funded. So PhD programs, you should not go to a PhD program unless you're getting some sort of funding, because you should not be paying for PhD programs.
All right, y'all. Here we are at the end of our program today, unless someone has a question that would like to ask. If not, I'll ask our presenters to share some closing insights before we head out, if y'all don't mind. Anything that you want to say to our folks before we head out?
I would say, just keep on searching for what it is that you are passionate about, right? And keep reaching out to people that, have more information about it. And just, honestly, undergrad is so underrated. Like, you can do so much exploring during your undergrad. I wish I could have taken more classes, right? Instead of just I don't want to advise not to follow your roadmap for your specific major, but also I would say, if you can and you have the ability to and the financial means to do it, take other classes that might not have been within your degree requirements, and just explore different things. Because honestly, I think that is the way that I was able to have this passion with health education and having a even more broader understanding of what that is, right? So yeah. Explore.
Yeah, kudos to Antonella. I agree. It's really a trial and error. I was in psychology for a really long time and then didn't pursue it because that wasn't what my interest was. But I don't regret it, because all the experiences I had, led me to where I'm at now. And at the end of the day, they were still really helpful. At the end of the day, I was learning how to do research, even though it's not the type of research that I'm doing now, but there's skills that are important. And we just have to get uncomfortable and sometimes just send those emails, or, I try to respond to everyone who emails me. You just never know who is having a good day that day. And just, if you reach out to them, they might respond and reach back,
All right. Well, thank you so much, Antonella and Iris. And
Thank
everyone
you.
for coming out. Thank you so much, y'all. We'll have another one soon. Hopefully you're enjoying these and starting to shape what your future looks like, right? Whether it's in public health or dentistry or nursing, we're going to find it. But thanks for coming, and we will call it a night. Bye, everybody.
Bye.
That was very informative.
Yeah, right. That's what we were hoping.